we're just gonna
Just
roll and do this.
Okay.
All right, so hey guys, Dr. Ben, and I am here with one of my favorite people ever. This is Tegan.
Hi.
She agreed to do a quick little video with me today talking about her TMJ. And take it away.
Okay, so for probably the past 4 years, I've had really bad jaw pain, and I didn't grind my teeth at night like some people do where they would get the mouth guard. I was clenching, and with that, you don't even know that you're doing it half the time. Probably after my second oral surgeon, I became really aware that I was clenching at like random points throughout the day. Like you really honestly don't realize you're doing it until you're really trying to pay attention.
Right, it's just like a reflex.
Yes.
But you're not controlling it.
Right, and even with trying to not clench and constantly think about it 24/7, I was doing it still in my sleep. Nothing I could do about that.
Right.
Mouth guards do not help the clenching.
Right,
It'll help the
still
grinding, but you can put the biggest mouth guard in there, and my mouth is still gonna bite down on it.
Bite down hard. Yep.
So I just constantly was in pain in my jaw, rubbing it all the time.
24/7, right? Unrelenting.
24/7, nonstop. I almost got used to the pain, especially now that it doesn't hurt the way it did. I realized like how crazy and debilitating it was, and how much I had adjusted to constantly hurting in my face 24/7.
Yeah.
I know that when I messaged you and I came to you, like I had been like bawling my eyes out that morning, and that would happen occasionally. It would get so bad where I would just be crying nonstop, and then that would make it worse.
Yeah.
But,
right, I can only imagine.
And I had seen 3 oral surgeons in a matter of 4 years, and there was the mouth guards, there was the muscle relaxers, there was a whole bunch of other crazy nonsense that was a waste of money that didn't work.
Didn't work. So she came in about 2 weeks ago now, right? And we actually targeted her masseter. So your masseter muscle is this big guy over here. That's the one that's giving most of the power when you're actually clenching down your jaw. I think I've done videos where I've showed the masseter muscle. So if she clenches down, you can kind of see my finger going in and out. So we hit it with some Botox. We did 16 units on a side the first time around. What's your experience been since we did that?
It's crazy. Like when the pain first went away, I thought it was kind of in my head and that I was going crazy, because I was like, no, I'm just thinking into this too much. I'm making it not hurt, because I was so used to living like that every day for 4 years that when it doesn't hurt anymore, you're like, this can't be real. It's crazy. Even right now, it's so amazing, and I'm not in pain, and I wake up and it doesn't hurt, and I don't have these headaches, and my neck feels better. But these are strong, so I'm coming for a touch-up.
Yeah, we're gonna do a little bit more tonight. So is that all right if we show them doing the little treatment? So we're gonna do a little bit more. This side is still her painful side, so I'm gonna do 6 more units on this side.
But even painful, like it's not. I can just still feel it. Like people who have TMJ, those of you who have it know that it is. You can't explain the pain. It's not like a burn. It's not like a cramp. It's so bad.
Yeah.
And the pain that I have now is not even in the same universe as before.
Of what I was.
Yeah, so it's like hard to explain, but I can still feel like a little smidge. And now that I know what it feels like to be normal, I'm not dealing with that.
Yeah, at all.
No, at all. It's going.
And you don't have to.
No.
Botox.
Botox.
Who knew, right?
Right.
Well, I knew.
You knew.
I knew. Now everyone's gonna know.
Yes.
Okay. So we're gonna go ahead and do this. I'm just gonna clean you up 4 more times since I was touching you. So this side I'm doing 4 units into her masseter muscle. And this other side we're gonna do 6. Easy peasy, just like that.
It is. And if you get Botox in your forehead, it hurts way less than that, and that doesn't even hurt.
That doesn't even hurt.
So.
Well, thank you for sharing your story. I really appreciate it, Tegan.